State health officials have selected 4 sites that will isolate and care for suspected Ebola patients in Minnesota, should there be one.
Unity Hospital in Fridley is one of the locations. This week, CTN's Bao Vang visited the hospital and got a tour of the containment unit.
If there ever were a patient with Ebola here in Minnesota, one of the 4 hospitals designated to treat them is Unity Hospital in Fridley. And staff say they are prepared.
We feel confident that we have the necessary training, the necessary equipment to take care of a patient should they show up.
Dr. Paul Kettler, the Vice President of Medical Affairs at Unity, says the hospital's expert staff and physical space will be important in quickly containing and isolating Ebola, a virus transmitted through bodily fluids. The containment unit, currently prepared to care for 2 Ebola patients, is intentionally located in the intensive care unit, right above the emergency department.
And what this is it's a special plastic with a zipper, and it can self-contain the unit and create a barrier between these rooms and our other patient rooms.
Unity staff are continually training to create a barrier between themselves and the patient's bodily fluids, trying to prevent a case like that in Dallas, Texas earlier this month. The nurse's exposed skin is thought to have played a role in their contamination.
This is one of our personal protective equipment kits, and within it there is a gown that's impermeable to fluids. There would be shoe and leg coverings, there would be gloves, and then there would be a hood that would also cover the head and the shoulders.
While Dr. Kettler believes the likelihood of Ebola arriving in Minnesota is small, they aren't taking any chances with lack of preparation. In Fridley, Bao Vang, CTN News.
The U of M Medical Center in Minneapolis, the Mayo Clinic in Rochester, and Children's Hospital in St. Paul are the other 3 hospitals designated to treat Ebola patients.